All right, I'm going to show a little bit more work on little Bubs here. I'm doing mostly cranial upper cervical stuff so he can stay wrapped in his blanket. But one thing that I've noticed is he came out with his left hand by his face, and he really likes his left hand. And he tends to he can look both ways and has full range of motion, but he does want to look that way a little bit more often. So when I checked him on day 1, here, we're going to pull this down, Bubba. I know. I'm sorry. Hi. I'm going to work on you, okay? What I noticed is that, hey, you're okay. His left side of his neck is a little bit locked up in that occiput. So I'm going to do a little bit more work here. Hi. Pushing more onto the left side, but getting him into some extension of his occiput. He wants to be a little bit more in flexion. Hi, is that a little uncomfortable? Yeah, I'm sorry, baby. And then now I'm going to work down to his upper cervical C1 and work on that left side as well. It's just a lot more locked up in that area and not moving quite as well. You got it, buddy. Let's move this out of the way a little bit. Yeah. Good. Oh, yeah. Hi. Yeah, hi. So again, I'm going to do some left occiput extension. He doesn't like quite as much. Some lateral flexion too. Hey, yeah, you got it, buddy. Good job. And then he has still some overlap of his frontal bone here and even some midline stuff here. So I'm just doing some cranial checks on him. Why not? If your mom's a chiropractor, why not have her do them, right? Hi, Bubba. Checking out some sphenoid stuff going on. It's moving really well, so I don't need to do much there. Hey, I know. Hey, you're good. I like to check function of the tongue as well, which I'll go through briefly once I'm done here doing some of the cranial work. Oh, you're good. Oh, I know. So when they cry, it's actually really nice for me. I get to see where that tongue goes, how it curls. I want to see that tongue come up when they cry. I want to see a little bit of a curl, but I don't want to see a bowl that's stuck to the bottom of the mouth. I also like to see when they're sleeping, if I lower their jaw, that tongue is up on that palate, which has been happening for this little one. I've already put my finger in his mouth, and I am his mom, right? So I'm going to put my fingers in his mouth in a second here without a glove on. It's the perks of when it's your own child. So when I do, can I feel? Let me feel. Let me feel. Let me feel. Hey, it's okay. I feel a nice wide open palate. His palate's like one of the best palates I've felt. So I was like, yes, you're my kid. This is great. And then I want to feel him cup. So he's cupping my finger right now. And then what I want to see is when I lower down his jaw, that he stays cupped on my finger the whole time, which he does a good job with. So he's staying cupped. I wait when I feel when they're on my finger, when they pause in between their 5 to 6 suckles, does it stay cupped? And it does, which is great. I play around with sucking tug of war. So I start pulling my finger out and I want to see them win and pull it back in. Good, Bubba. You got it. There you go. He's pulling it back in now. I pull it back out. He's pulling it back in. Good. I'm not going to do any lifting up underneath his tongue right now because I've already done that to him, so I don't need to harass him today. Lifted up his lip. And so you're not looking at structure. You can. That gives you an element. But I'm looking at what happens to his lip when he's nursing. It flanges out. When I lifted it up, his lip easily comes up. I've checked out buckles to see if there's any tension. There's not. So his palate is beautiful. His cupping of his tongue is beautiful around my finger. I can feel it at the breast as well. I'm not going to be happy if I move my finger out. I swipe along his gum line. I'm able to see his tongue follow. Again, I've already lifted to see structurally and things aren't of concern. He is able to open his mouth nice and wide to get around the breast. Palate is in a beautiful spot. Cupping's in a beautiful spot. He lateralizes. His tongue is up on his palate when he's sleeping. His mouth has stayed closed most of the time. Every so often it's been hanging open. And I just go up underneath the jaw, behind the chin bone there, the jawbone, underneath where the tongue is, and I just hold it closed if it's not, just to train better patterns. But all in all, like suckle and everything looks great on him. I'm not seeing any issues with like nursing blisters, anything like that. So that's something in the beginning, is not only checking out upper cervical and occiput, cranial bones and shifts that are happening, which again, we don't need to be worried at. He's only 36 hours old, about a little bit of overlap still, because I've already seen shifts really happen. But it doesn't mean we can't do cranial work and work on those if we have these babies earlier on. And then I'm checking that suckle. So upper cervical, occiput, cranial bones, and then what's going on with suckle is the initial. And then yesterday I already checked out the rest of his spine and his hips. And the biggest thing that I noticed was his upper cervical and occiput on that left side.